Hey folks, I'm attorney Ben Schwartz. Today we're going to do a quick video to answer a question from Cam in Rehoboth Beach, Delaware. Cam wrote in, he said, essentially, I keep seeing ads for nursing home lawyers talking about pressure sores. Is that really a thing that people sue about? Can you do a video and talk about this topic? And Cam, that's a great question. You know, I've seen these ads too. Essentially, you'll see these TV ads. They tend to be for like Baltimore and, Philadelphia law firms where they're talking about if you or a family member were in a nursing home and ended up with a pressure sore, you may have a right to receive compensation for your injuries. And I agree. Like before I became an attorney and knew anything about it, I would see this and think like, is that really the type of thing that people sue about, getting like a sore in a nursing home? But now that I have had these cases and I've seen what they're about, I can tell you a little bit more information, and I do think it's like terribly serious stuff. So basically, here's what this is about. People go into nursing homes, and sometimes these are older folks that are infirm, that go into a long-term care situation, a long-term care facility. Sometimes these are folks who are maybe just like in a rehab center for a month or 6 weeks or 2 months, maybe after like a total hip replacement surgery or something like that. Either way, if you're a patient in a nursing home, you cannot be permitted to just lay in bed without moving, without shifting, without turning or moving around in any way. And the reason is because if you're just permitted to lay there in one position all day, you're putting pressure on certain spots, where you have what's called bony prominences, where your tailbone is, or your sit bones are, or the bones in your back are. If you lay in that one spot, that bone pushes down on the bed and puts pressure on the muscle and the fascia and the skin, and it creates a situation where there's a lack of blood flow there, and you can develop a sore from the pressure. It's a pressure ulcer, or what's called a decubitus ulcer. The problem with this is these types of sores, these types of wounds get bigger and bigger and bigger. They can get very deep. They can go all the way down to the bone, and they can be very, very hard to heal. They can be extremely painful for the patient. And to make matters worse, if they get infected, the infection can spread throughout the body, can go into the patient's blood, and that's called sepsis, where they've got sort of a system-wide infection, and it can actually kill the patient. So when you see these TV ads for law firms talking about nursing homes and pressure sores or pressure ulcers, what they're basically saying is nursing homes are required to keep the patient moving. Even if the patient can't move themselves, they're supposed to move that patient around, turn the patient, go in and move them around every so often in order to avoid getting pressure sores. And if they don't do that, that's negligence, and it would give you, as the patient or the family member of a patient, the right to sue the doctors, nurses, and nursing home itself for failing to do what was reasonable and necessary for the patient in their care. And what these law firms are saying is there's a need, if you have this happen to you or a family member, there's a need for you to contact a law firm, because if no one is forcing the nursing homes to take care of the patients, if there's no consequences for failing to turn the patients, it's just going to happen over and over. So I think, yes, it really is something that people sue over. I think it's very important that if you have this happen to you, or if this happens to your family member, I think it's very important that you get a consultation with an attorney that handles nursing home negligence cases in your jurisdiction. And I think it can be a disastrous type of event to have one of these pressure ulcers or pressure sores. So that's my view of it. I hope that answers the question. It was a great question, Cam, and I thank you for sending me the question. If you have a question, if you're watching this video, you have a question and you think to yourself, this question is something that I should send to Ben Schwartz so he can do an explainer video, send me an email, ben.schwartz@schwartzandschwartz.com. Thanks for watching.